What is the importance of bone density? So as for the layperson, for me, for my wife, why do I care about bone density, and how's bone density impacted here by eating disorders?
All right, so bone density is essentially, if you want to think about it visually, which I like to do because it just kind of helps me understand like why this is important. A healthy bone has what we think of as like a really complex microstructure. So when you were to look at that in an X-ray, it's going to look really dense. You're going to kind of, be able to notice that there's not a lot of space in between the fibers of a healthy bone. If someone has a low bone mineral density, you're going to see holes, kind of like places where the fibers are less dense, and it starts to look a little bit, more just a lot of more black space, if you want to think about an X-ray for me. Now, what does that mean? That means that if there's pressure or force on the bone, it is going to have a lot less of those fibers resisting breaking. So what happens if you have a low bone mineral density is your risk for injury is going to skyrocket. Why does the rest of us care about bone mineral density? Because again, these injuries can be really problematic for our daily lives. And if you think about some of the places we take bone mineral density in that paper includes your spine. And so what you don't want to do is have low bone mineral density in your spine. I mean, what I usually tell my adolescents, because they really don't like this, is that like that's what leads to the hump. Like when you think about people who are really old and have like the hump, that is micro breaks all on their spine. And so when you're thinking about like, especially if you want to kind of challenge the eating disorder, like if you're trying to look a certain way, I imagine it's not having a hump. And so bone mineral density is just really important.